Dr. Fazeli, I'm a geriatrician in Southern Maine, and I'm preparing this video for families with loved ones in nursing homes and facilities around the state. And the date today is March 30th, 2020, and the primary question that I've been asked that I want to answer with this video is what can we do to help the staff and facilities? So what can families do? And I would say aside from staying at home like everybody else. You gotta acquaint yourself with some of the changes that happened in the past couple of weeks in nursing homes and how much extra work the staff having to do around vital sign checks, extra vital signs checks, monitoring more residents more frequently, doing swabs and testing, sending tests to the lab, calling the doctors with negative results, reporting any exposures, reporting any staff symptoms, testing staff, sending lab results about staff to the medical directors. All of that extra work means they have less time. So what families can do is be mindful of that lack of extra time during these days. So if you have a larger family and you normally have multiple people calling to check on your loved one, designate one person if you can to do the talking and to get the updates to the rest of the family. If you are calling, please be mindful not to take too long on issues that could wait, or address some issues later if they're around something that is not immediate. There's no immediate problem that needs to be addressed. Having said that, if you're in doubt, if you're not sure, please bring it up. And from my personal experience, I can tell you staff are calling more, not less, because they need to update anyone given the lack of visits allowed. One last thing I want to say is if you see facilities testing, that doesn't necessarily mean there's a problem. Everybody's testing to stay clean, to stay safe. So if people are testing left and right for any symptoms that they see, that's a good thing. So don't take that as a negative thing for a place because they're testing for COVID-19. I'm sure there will come a time in Maine that there will be positive cases. We have positive cases now in almost every hospital in Southern Maine. We don't have any cases in assisted living or nursing homes, but if there is, people have plans and they will keep everyone safe and do their work and do their job. But in the meantime, if they're testing, there's no reason to be alarmed by the mere fact that they're testing. And I want to mention one more thing, which is around end-of-life care for hospice patients, or if someone is on palliative care around these times. And I'm not talking about COVID cases. I'm talking about regular natural cause death cases. If someone is at end of life on hospice, most, if not all, facilities are making provisions for people to go in and visit. Just if the families could, preemptively think about who would go in and visit, because more than one person visiting a hospice patient, even though it's really necessary and comforting for everyone, if it's more than one person, it adds to the risk for you and for the workers at the facility. So think about who wants to go or who needs to go. And that's it. I hope you find this useful. Know that everybody's working hard for you and for your loved ones. And we appreciate your support. You don't have to like or subscribe. Just pass it on. Thank you.